Hi, my name is Lindy Schmidt, and the topic that I chose to write my literature review on was the physical and mental health risks for low-income pregnant women. The research question that I led my research off of was, what are the implications on mothers and infants who experience poverty during pregnancy? To start off, here are some facts. In 2014, 41% of all women who had given birth that year lived in a low income household. The infant mortality rate in the US among white Americans is 4.5, while the infant mortality rate for Black Americans is 10.6. Along with that, 18% of the Black population was experiencing poverty in 2019. This is something that I further researched in my lit review to try to look at if there is a correlation between poverty and the infant mortality rate. Lastly, about 1 in 12 babies are born with low birth weight in the United States. Here's just a further look at the infant mortality rate across different races. Again, you can see that the Black population is at about 10.6, while other populations like non-Hispanic white and non-Hispanic Asian are at 4.5 and 3.4. So I divided my findings into three different sections. The first section was regarding the physical health of the low-income pregnant mother and the baby. The second was the mental well-being of the mother and baby. And the third was the responsibilities of doctors and how they can help these women. So first, for the health of the mother and the infant. Living in poverty can inhibit a pregnant woman from receiving proper health care while pregnant. It was found that this is due to several different reasons. Some of the barriers that affect this can be transportation for the mother. It could also be women who live in rural areas have a harder time getting to the doctor's office. But infants born without prenatal care are 3 times more likely to have a low birth weight and 5 times more likely to die. Statistically, people in poverty are more likely to abuse substances than others who are not. Long-term harm or death of the fetus can occur when a mother smokes, drinks alcohol, and abuses drugs. Low-income women may struggle to afford healthy foods to eat while pregnant, and nutritional deprivation can have lasting impacts on a fetus. So, regarding the health of the mother and baby, receiving prenatal care and the quality that a mother of care or the quality of care that a mother receives, along with substance abuse and the quality of nutrition a mother gets, can all impact the health of her and the baby. So the mental well-being of the mother and infant, I found a study where women who gave birth to low-weight infants reported that they had financial issues to worry about during their pregnancy and that they had a lack of social support. For low-income women, buying necessary items like formula has been linked to postpartum depression symptoms. I think this is a really important finding because babies are expensive and there's lots of necessary items to buy along with formula, like clothes, diapers, their cribs, car seats, and those purchases happen often. And so the link to postpartum depression symptoms could be very strong for low-income women. Stress of the mother can impact her ability to bond with her baby, and that could both impact her and the baby as well. So to move on to the responsibilities of the doctors, with a lack of social support, women in poverty can oftentimes feel isolated. When these women visit their doctor for prenatal visits, they should be met with support and encouragement. I think this is really important, along with the help that doctors provide to women for their physical health. I also think that their mental health should be prioritized while they're meeting with a doctor. Here are some ways that doctors can help a low-income pregnant woman. First, they can encourage the woman to bring other supportive family members or friends or the father of the baby if he's involved to the appointments. This could help her feel more support and less isolated. The doctor could help educate those family members and friends on the process of pregnancy and how they might help that pregnant woman so she can receive care from others around her. And lastly, the doctor should evaluate the mother's needs and give her resources to things like formula, therapy, parenting information, and at-home practices she can do to improve her mental and physical health. I think all of this would really help low-income pregnant women feel more support and like they have more resources to turn to when they are feeling stressed. So, low-income pregnant women experience issues with lack of health care, lack of access to formula, cribs, healthy foods, etc. They may not be able to afford rent, and they may not have a reliable mode of transportation. This can really impact their ability to get prenatal care. All of these issues can have a lasting impact on the mental and physical health of the mother and the baby. One thing I think is important to reiterate is that women who are pregnant and low income have more sources of stress and less resources to cope. I think this is really important to their overall health. Um, and I think when women are in a low income household or are experiencing poverty, they are experiencing stressors very often, but do not have resources like a good social support system or therapy to help them through those difficult times. Other issues that can affect a mother's physical and mental health include financial difficulties, job loss, divorce or separation, domestic violence, homelessness, incarceration, and again, lack of social support. So, for the strengths and limitations that I found throughout these articles, first of all the articles were peer reviewed, which I think is a strength. And another strength was that sample groups found in the articles were found in doctors' offices in urban areas where many low income pregnant women live. So I think that the struggles and hardships listed by those pregnant women were very accurate. The limitations, there was a lack of information given from doctors and healthcare providers to see their point of view on the issue. And more information could have been found regarding why low income women either avoid receiving prenatal care or can't receive prenatal care. Um, the methods that were used, the literature was reviewed in November of 2022, and it was found through the EBSCOhost database, and both qualitative and quantitative articles were reviewed. For future research, I thought of some topics that I think are important. First of all, I think it would be important to research how women on Medicaid are impacted by these issues and the correlation between Medicaid and the quality of care that women receive while pregnant. Another issue that would be interesting is women who are low income and have fertility issues. How do they conceive and get help conceiving? Because I know those resources are very expensive. And then lastly, why do some low income women not receive prenatal care? And just taking a further look into the barriers that exist in receiving that care for low income women. Here is my reference page, and thank you all for watching.